I think it's important to have realistic expectations anytime you're having surgery, but in particular in the revision surgery setting, because it's not the same as a primary surgery. Each revision is unique. The recovery can vary, but what I would tell you is you can expect that the recovery to be a little bit longer than just a regular routine primary surgery. And it's oftentimes really figuring out how to manage that differently with each patient depending on the situation. So in this particular case, we were taking out an old implant and putting in a newer implant, but the newer implant has longer stems and is more constrained with, in this case, a hinged prosthesis to provide more stability. And when we do that, it's a little bit of a different sensation that people say they have when they move the knee. So the first component is healing the wound, healing the incision, making sure that we're getting that motion back. And that's a little bit more uncomfortable in the immediate postoperative period. So really our job is managing that pain, managing the inflammation, ensuring that you get that motion back and you get it back appropriately. And then as you're going through recovery, we can change things around as needed to make it more comfortable.